So Aerolase has created this concept, 650 microsecond 1064 technology, okay? Getting enough fluids within a very short pulse duration. If we do that, then we get rid of some of the concerns of how are we going to be able to, are we going to have a lot of pain, are we going to have a little discomfort, are we going to have a big risk of PIH? Those things can be eliminated if we can limit the pulse duration and shorten the pulse duration, and that's sort of what's gone on. So we get rapid heating of the target vessels, we can leverage the power, the depth, and the hemoglobin, but avoid collateral damage. And it's that collateral damage, the thermal damage that you get around the vessels and everything that causes the problems, the increased risk of scarring, the increased discomfort, and the risk of PIH, which again, in my world, is the most important world, as I spend most of my world, if I'm not in the US, I'm in Asia, so PIH is all I hear about. Does it cause PIH? What is PIH? How much? And so forth. So the LightPod Neo and they're very versatile machines. We can treat not only vascular, but we can actually extend this into other things, pigment, acne. If you believe that you want to treat nail fungus, treat nail fungus. I'm not a big nail fungus guy. I'll show you nail fungus. But I don't treat a lot of nail fungus with lasers. But it's safe for all skin types, and that's really important. If you long pulse duration, not so good. Shorten the pulse duration. We can extend this out on all skin types really, really safely. And again, we use the 1064 on darker skin types, but we're trading efficacy for safety. If we don't want to trade the efficacy and we want it safe, we're going to shorten the pulse duration. And there's no cooling either needed, which is also a unique thing of this device. They'll talk about price, but there are no consumables. I hate consumables. I always have hated consumables. Some laser companies, the model is consumables, and that's fine. I don't want to be I'm not in the market to be in the consumable business. So again, high power, high depth of penetration. It is really a gentle treatment. Patients tolerate this exceptionally well. We can cover a lot of different things, vascular and other conditions. You don't need skin contact by the handpiece, and it really is no cooling, and I don't use anesthesia when I do this. And we use this to treat a lot of our patients. So, again, one of the nice parts is now there are some clinical science papers that have been published. And I haven't done this, so I haven't published these things, but I'm part of this group of working with some of these guys. And so we know we can do this for hair removal very well. That's been published. And again, there have been several papers now that have shown hair removal works really effectively with this. And in this one, 85% of the patients had an overall satisfaction rate, and only 10% weren't satisfied. So when you look at satisfaction with this, it's pretty high. And again, a lot of these patients were dark skinned, and that's really important. The biggest part of this was that there was no adverse event in this patient population of significance, and that's important. I mean, we have to look at the adverse event profile. David Goldberg group just finished a publication looking at using this to treat facial telangiectasias. Where this shines, though, and I think we all have to keep in mind, this shines in the vascular world. And so, for vascular lesions, this is sort of, one of those machines that I never tell my clinic staff really what to use. And I'm finding that every time I'm going to the office, into my lasers part of my practice, I'm hearing this sound. And I'm like, what are you treating? Oh, we're using the LightPod and so forth and so on. So, and Pablo will be glad to hear that, because I've had this stuff for a long time, and it's okay. And then more and more and more as they're using it, their comfort level has gotten so high with this that it works all the time. And so it's a kind of machine that we're used to using, that we can treat lots of different kinds of facial veins very successfully. Here's one of my patients that had some actually more excoriated as well as some facial veins, and one treatment, boom, gone, clear, and that takes care of it.